I'm Greg Mcintyre, this is Shelley Watson. We're from a small animal and mixed practice in Kyneton in central Victoria. We have been involved with IDEX laboratory services for a long time. I first got a QBC hematology machine and a vet test chemistry machine probably in the mid-90s when they first came out. It was a big investment for me, a bit nerve-wracking, but the impetus really for us at that time was that while the laboratory services we had access to were excellent, in fact IDEX's predecessor in Australia, CVDL run by Dr. Peter Lording, was around, and we had a good laboratory service in Bendigo. The delay of turnaround for results meant that critical cases could not get any laboratory service.
All of the staff find it really easy to use, and I think enjoy having something or appreciate having something that they can get results from really quickly, and I know the clients definitely appreciate it.
So I would add that one of the best things we've done is to assign Shelley responsibility for maintenance. But the maintenance, cleaning and what do you call it?
Quality control.
Quality control was at best sporadic when I was in charge. But since Shelley's been in charge, we've set up some significant systems to follow through and do the proper maintenance at the correct intervals. And I personally feel much more confident in the quality control now that Shelley's doing that on a regular basis. Although I must say the machines are pretty stable in their quality. We hardly ever find a quality control problem, but it's nice to have the knowledge that the quality control is there. It's been a big thing for us in terms of patient care. Laboratory services pickups have improved. It's in that time, but it's because of our experience of using it, we find that having it in-house available is broadening our ability to manage patients well, and helps us to overcome some of the impatience that clients sometimes feel, although they're usually shocked because they go to the doctor and the doctor tells them to come back in a week for the blood test results, and we say, can you wait in the waiting room for 10 minutes and we'll tell you. So they're quite impressed with that, and they think that the vet's better than the doctor, which we all know anyway. We love the fact that we can get good phone support, and the phone support technicians are excellent in their ability to cope with guiding us out of the corners we've got ourselves into. Occasionally there have been times when the problem couldn't be fixed, and the overnight supply of replacement equipment is brilliant while we get the problem with our equipment sorted out. And of course the backup to that is that if we can't use our equipment, IDEX Reference Laboratory carries out the same test for free until the machine is fixed. So it doesn't solve the problem and wanting an answer right now, but except for having two sets of equipment, we're never going to get to the point where it's 100% reliable, but we're pretty close to 99.5% reliable, and we get good backup service. We use quite often the internal medicine specialist consultations, which are provided free, as well as, of course, the invaluable advice from the pathologists themselves in the laboratory. And those services that are sort of add-ons to having the equipment in-house have been a real bonus for us. It's just been an organic evolution, if you like. We've had stuff, we recognised the limitations of the early machines and looked at how we could improve on those things. The way we were using them, of course, gave us confidence to press on. But each time it's been a nerve-wracking experience to make the investment, and each time we've been glad we did. The most recent one was the SediVue, and I consulted with our other vets about that, and at first there was a significant amount of dubiousness about the value of doing that. But it's easy to just spin down a urine sample and stain it and blah blah blah. But
I don't think anyone does that now.
The minute we got it, everybody started using it, and now the skeptics are fully converted, I might say.
I think we do a lot more pre-anaesthetic profiles now. So for routine surgeries and things, I think we have a lot more clients that are taking on pre-anaesthetic profiles, which now we're often running on the morning of the surgery. So it's given as an option to the client when they come in, and if they want to take that up, then we run the bloods before we even pre-med the patient. So, and that's something that, you know, without this system that we wouldn't be able to offer. We'd have to send the bloods away, then wait, you know, delay all that whole process. So, and I think more and more clients are taking that up as an option.
We can use our IDEX machine to monitor daily patients like snakebite patients to have an objective way of knowing when it's safe for them to go home. And making the initial diagnosis, of course, too. And we can monitor our acute patients like Addisonian crises, diabetic ketoacidosis and the like. We can monitor critical parameters to help us to adjust our treatments. And we can do things like adding potassium to infusions confidently, that we know that we're not going to overdo it and damage the patient. So in our acute patients, we find that very, very useful.
That real time, being able to run it while the client's in the waiting room. You know, people are surprised they come to pay the bill and you're already running their bloods. So, you know, I think that's really valuable.
It's pretty hard to complain when you get so many new things coming online so quickly. In the time I've had the machine, we've added on phenobarbital, cortisol, T4, and then shifted the T4, the SDMA. We've shifted the T4 from a separate test in a separate machine to where it runs in conjunction with our other tests. And now the bile acids and the other tests that are coming online all the time. There's the species-specific lipase, pancreatic lipase tests and the like, pro-BNP, just a number of them coming all the time, both in the reference laboratory and available to us here, and the backup we get on those as well.